When I first came to White Plains, I really didn't know what to expect, and I shortly learned how much easier it is to work at a smaller institution versus a large institution. I think that as a physician, one wants to believe that you're caring for your patients in the best possible way. Your patients are getting not only expert care, but they're getting very personalized care. I think about how my father and I would feel, or the family that's waiting, that they're really concerned about the person they're operating on, or a parent of a child, how I would think if this were my child. I really enjoy the relationships with my patients, and I like seeing them, and I like knowing about them and their families and what's happening and where they're traveling. Yesterday I saw patients that I've known for 10 and 15 and 20 years. What happens here, and I call here maybe smaller, we all talk with one another. We talk with one another a lot. We talk with one another on weekends, at nights. For instance, Dr. Costin is a medical oncologist. We often talk at 10 or 10:30 at night. It's wonderful because we gather around our patients, not just as isolated individuals working in a vacuum, but as a team.
He uses the entire team to make sure that the care that's delivered to that patient is not only optimal, but expert and exceptional all the time.
One of the wonderful things about being in medicine is that our field constantly changes. Now we do robot operations. It's exciting. It's fun to be able to take care of people in new and better ways. What the hospital has done for us, they've built this new state-of-the-art operating room, which is incredible. All our instruments, including our anesthesia machines, all our monitors come from the ceilings. And as we do these different surgical techniques, laparoscopic surgery, robotic surgery, the room is well set up for that. This OR, I'm sure, rivals anything of this type of state-of-the-art in the country. I think maybe the one thing that distinguishes me is that I'm never in a rush. I always focus on what I'm doing, I finish what I'm doing, I move on to the next, and I hope my patients never think that I'm rushed with them. Certainly in the operating room, I'm never in a rush. We're focused, we're not distracted, we do things perfectly, and then we move on to the next. I think I have the best job in the world. I get to do wonderful things for people. I get to help people. And I feel very fulfilled at doing that, and I feel very lucky to be able to do that.